Hey everyone, welcome back. We're kicking off the new year with a deep dive into winter respiratory illnesses. I know you're all probably wondering about staying healthy with all this talk about new COVID variants.
It's certainly been a busy season already.
So to help us break it all down, we have our expert here with us today, and we've got a ton of reports from medical experts and public health organizations to go through.
Lots to talk about.
Let's get right to it. COVID. Uh, it feels like after a bit of a quiet period, cases are starting to rise again, both nationally and right here in Massachusetts.
Yeah, we are seeing that upward trend again.
It's almost like we're seeing a repeat of those patterns from the past few years that led to, well, those winter surges.
It does feel a bit like déjà vu, and the data seems to be backing that up. Early January saw national test positivity rates hit 6.9%.
Oh, wow.
And here in Massachusetts, it actually jumped to 7.9%. We're also seeing an increase in emergency room visits across the U.S. related to COVID.
And I can't forget about wastewater surveillance. I remember that being a pretty reliable indicator early in the pandemic. Are we seeing anything interesting there?
Absolutely. Wastewater data is showing a return to high levels of viral activity nationally. And in Massachusetts, the levels are very high right now. It's a very sensitive measure. It can pick up on those rising infections even before people show symptoms or even get tested.
So are we potentially looking at another winter wave? On top of that, everybody's talking about this new dominant variant, XEC. Sounds a little scary. What can you tell us about it?
XEC is definitely one to keep an eye on. It's essentially a combination of two earlier Omicron subvariants.
So like a hybrid.
Yeah, exactly. It's basically taken the most transmissible features from its predecessor.
Well, that explains why it seems to be spreading so quickly. What does that mean for us in terms of severity? Are we looking at more serious illness?
Well, that's the good news. For now, the symptoms seem pretty similar to past strains. We've been following Dr. Omar Awan. He's a medical expert, and he's been pretty vocal about this. He describes XEC symptoms as generally mild things like fever, cough, runny nose, sore throat, the usual suspects.
Well, that's a relief. I do remember, though, hearing that this new variant might be a recombinant of two different genomes. Is that something we should be concerned about?
It's definitely something that scientists are watching closely. Whenever you have that kind of genetic mixing, there's always a chance that the virus could, behave in unpredictable ways. Increased transmissibility, maybe even the ability to evade existing immunity. But we need more data, more research to really understand the implications.
So it's a watch and wait situation for now. And of course, the next big question on everybody's mind, how effective is the 2024-25 COVID vaccine against this XEC variant? I imagine people are wondering if it's even worth getting.
Yeah, it's a crucial question. And of course, the current vaccines are based on earlier Omicron strains.
So maybe not a perfect match for XEC.
Right. However, they are still expected to offer protection, especially against severe illness, even if they're not a perfect match. Dr. Ellerin, who's an infectious disease specialist, he's confident that the vaccines, while they may not prevent all infections, they'll definitely reduce your chances of ending up in the hospital. And there's even a chance that they could lead to milder symptoms if you do happen to get infected.
So vaccination is still a pretty powerful tool, even as this virus continues to evolve.
Absolutely. It's still our best defense against the worst outcomes.
Okay, well, COVID's been dominating the headlines, but it's definitely not the only respiratory illness going around this winter. We're seeing a lot of flu and RSV out there, too. I understand they're hitting pretty hard as well. Is that right?
Yeah, you're right. Both flu and RSV are circulating at elevated levels. We're seeing a noticeable spike in emergency room visits, actually. And this kind of highlights another layer of protection we have available to us. Vaccinations for flu and RSV.
All right. It's easy to forget about those with all the focus on COVID. What are the latest recommendations for those?
Well, for the flu, it's a yearly shot. And it's especially important for folks in those high-risk groups, older adults, very young children, pregnant women, and anyone with underlying health conditions.
And for older adults, I remember hearing about different types of flu shots. What's the difference between them?
You're right. For anyone 65 and older, there's a high-dose flu vaccine, as well as an adjuvanted version. Adjuvanted vaccines contain an ingredient that helps create a stronger immune response, which is important as our immune systems naturally weaken with age. So both of those are designed to offer more robust protection for this age group.
That makes sense. Now, what about the RSV vaccine? Is that a yearly shot, too?
RSV is a little different. It's actually a one-time dose, unlike the annual flu and COVID shots.
Oh, that's interesting. So who should be getting the RSV vaccine?
Well, the recommendations right now are focused on those at higher risk. That includes anyone aged 60 to 74 with underlying health conditions, and everyone 75 and older. Another key group is pregnant women in their third trimester.
Why the focus on pregnant women?
Well, when the vaccine is given during pregnancy, it can actually provide protection to their newborn babies, who are especially vulnerable to those severe RSV infections. It's like giving them a head start in building their immunity.
So it protects both the mother and the baby. What if a baby's born during RSV second and the mother didn't receive the vaccine? Are there any options for the baby?
There is. There's a monoclonal antibody called nirsevimab that can be given to these infants. It's a single injection that helps reduce the risk of severe RSV illness. It's a really valuable tool, especially for babies born during, peak RSV season.
Wow. So many options available these days for protection. It's amazing how much progress has been made in understanding and combating these respiratory illnesses, but I have a feeling there's even more lurking out there in the winter air.
Right. You're absolutely right. There's another one we should talk about, mycoplasma, sometimes called walking pneumonia. We've seen it making headlines lately, especially with cases surging among younger children.
Walking pneumonia. That sounds kind of scary. What exactly is it?
It's a bacterial infection that affects the respiratory system. And the nickname comes from the fact that it often causes a milder form of pneumonia, especially in children and adults. So, people might not feel terribly sick, but they're still contagious and walking around spreading it.
So it's a sneaky one. How is it different from the other respiratory illnesses we've been talking about?
Well, one of the tricky things about mycoplasma is that it can mimic the symptoms of a viral infection like a cold or the flu. You might experience fever, cough, fatigue, headache. So it makes it a little harder to diagnose because it presents like other common respiratory illnesses.
So how do you even know if you have it? What should people be looking out for?
Well, testing is key. A specific type of molecular PCR test can identify mycoplasma. So, if you have respiratory symptoms that aren't improving, especially if it's going around in your community, it's important to get tested and rule it out.
And what about treatment? Is it similar to how we treat the flu or COVID?
Well, because it's a bacterial infection, it actually requires antibiotics. Azithromycin is commonly used, and for older children, doxycycline might be prescribed. The key is, early diagnosis and treatment to prevent complications.
So another reminder that if you're feeling under the weather, don't just tough it out. Go get checked out by your doctor.
Exactly. Always better to err on the side of caution, especially when it comes to, respiratory illnesses.
Speaking of being proactive, there's been some news about the recommendations for pneumococcal vaccination. I heard the CDC actually lowered the recommended age. What's that all about?
Yeah, it's a pretty significant change, and it aims to protect more people from severe pneumococcal disease, which includes things like pneumonia, meningitis, and even sepsis.
And what is the new age recommendation?
The CDC now recommends that everyone over 50, regardless of their health status, get vaccinated against pneumococcal disease.
Wow, that is a big shift. What was the reasoning behind lowering the age?
Research has shown that the risk of pneumococcal disease increases significantly after the age of 50. So lowering the recommendation ensures that more people are protected during, those more vulnerable years.
What about the vaccine itself? Are there different types?
There are two main pneumococcal vaccines, PCV20 and the recently approved PCV21. Both are effective in preventing invasive pneumococcal disease.
So if someone over 50 hasn't been vaccinated yet, is it a good idea to talk to their doctor about getting one of these shots?
Absolutely. It's a simple step that can offer substantial protection against some, potentially life-threatening illnesses.
It's just another piece of the puzzle when it comes to staying healthy, especially as we get older. I also noticed that this change in recommendations specifically mentioned Black adults. Why is that?
That's a great point. It does, and it highlights an important health disparity. Black adults are statistically more likely to develop pneumococcal pneumonia at a younger age compared to other racial groups. So this change in recommendations ensures they have access to the vaccine earlier, offering more equitable protection.
That's a critical step towards addressing those health inequities. It's a good reminder that these recommendations aren't one size fits all, and they really need to consider the unique needs and risks of different communities.
Absolutely. It's about tailoring those preventative measures to make sure everyone has the best chance of staying healthy.
Well, we've covered a lot of ground here. COVID, flu, RSV, mycoplasma, and even pneumococcal disease. It feels like we're constantly being bombarded. With all these different respiratory illnesses circulating, What are the most effective ways to protect ourselves this winter? What are your top tips?
Well, as we've discussed, staying up to date on your vaccinations is absolutely paramount. That's your foundation for protection. It's the best way to minimize your risk of severe illness from these viruses and bacteria. But beyond vaccines, there are those everyday preventative measures that we should all be practicing diligently, especially during peak respiratory illness season.
What kind of things are we talking about?
Things like frequent hand washing, covering those coughs and sneezes. It's also crucial to stay home when you're feeling sick, especially if you have a fever, until it's gone. This helps prevent spreading it to others, especially those who are more vulnerable.
It can be hard to justify staying home sometimes, though. There's always that pressure to just push through illness, especially at work or school.
I understand. We often feel like we need to maintain that business as usual attitude. But the reality is it just puts others at risk. Staying home when you're sick is a simple act of responsibility, and it really helps protect the community, especially during cold and flu season.
That's a good point. So aside from hand washing and staying home when we're sick, are there any other measures we can take to help prevent transmission?
Of course. Wearing a mask in crowded indoor settings, especially if you're feeling under the weather or in close contact with someone who is, can really help reduce the spread.
Masks. They're back in the conversation.
They are. And while they may not be mandatory everywhere anymore, they're still an effective tool, especially for those who are more vulnerable or, simply want that added layer of protection.
That's great. It's good to have options and make informed choices based on your situation. Any other tips for staying healthy this winter?
Don't underestimate the power of good indoor ventilation. Opening windows, using fans, even investing in air purifiers. All of these can help circulate fresh air and reduce the concentration of those airborne viruses.
It's about taking control and doing what you can to create a healthier environment. I imagine these tips are especially important for folks who are more vulnerable to respiratory illnesses like young children, older adults, and those with underlying conditions.
That's exactly right. For those individuals, it's really crucial to be more proactive and take those extra steps to minimize their risk.
Well, this has been really insightful. I feel like I have a much better understanding of the current landscape of respiratory illnesses and the steps we can take to stay healthy this winter. It seems like there is a lot we can do to protect ourselves.
I'm glad to hear that. But remember, this is just a snapshot of a constantly evolving field. New research is emerging all the time, and our understanding of these illnesses is going to continue to grow.
So it's a constant journey of learning and adapting to new information. It makes you wonder, with so much information out there, sometimes conflicting, how do you personally decide which preventative measures are right for you and your family?
That's such a great question. It really gets at the heart of personal decision making when it comes to our health. It really is a lot to consider. I think, for me, it's about finding that balance between staying informed and being practical. It's important to keep up on those latest recommendations and research, but also we have to think about our own individual circumstances, risk factors, preferences.
It's not a one-size-fits-all approach then.
Yeah, exactly. What might work well for one person or family might not be the best fit for another. It's about, having those open conversations with your healthcare provider, weighing the benefits and risks of different preventative measures, and ultimately making choices that align with your values and your lifestyle.
And that includes everything from decisions about vaccinations to those everyday habits, like hand washing and masking.
Precisely.
Yeah.
You're essentially creating a personalized prevention plan that feels, manageable and sustainable for you.
I like that. It puts the power back in our hands. It's about taking control of our health and making informed choices based on the best available evidence and our individual needs.
That's a great way to put it. It's about being an active participant in those decisions.
And trusting our instincts. Knowing when to seek expert advice.
Absolutely. Never underestimate the value of your own intuition and the importance of building, those strong relationships with healthcare professionals that you trust.
It's about finding that balance between knowledge and action, between personal responsibility and collective well-being. I think this conversation about taking preventative measures really highlights that interconnectedness of public health we touched on earlier. We tend to think of these illnesses as separate, but in reality, they're all part of a bigger picture.
That's a great observation. These viruses and bacteria, they're all circulating within our communities, and their spread is influenced by so many factors. human behavior, social interactions, environmental conditions, even access to health care.
So it's not just about individual responsibility then. It's understanding how our collective actions impact the spread of these illnesses.
Right. Think about the rise of XEC, for example. Its rapid spread is partially due to its highly transmissible nature, but it's also fueled by things like travel patterns, social gatherings, and the level of immunity within a population.
So many moving parts.
Exactly. And it shows why those public health measures need to be multifaceted. It's not just about vaccines, although those are essential. It's also about promoting, good hygiene practices, improving indoor air quality, and really encouraging people to stay home when they're sick to prevent further spread.
It sounds like this interconnectedness also applies to how we approach treatment and prevention.
It absolutely does. We can't just focus on treating one illness in isolation. We need to consider the potential for co-infections and how different viruses and bacteria may interact within a person's body.
What exactly are co-infections?
Co-infections occur when someone is infected with more than one pathogen at the same time. It could be the flu and COVID-19 or even RSV and mycoplasma.
And what are the implications of co-infections for our immune response and overall health?
Co-infections can definitely make things more challenging. They can lead to more severe illness or complications. So it's something that healthcare providers really need to be aware of when they're, diagnosing and treating patients.
So it's not as easy as just checking boxes on a symptom list.
Not at all. It requires a more holistic approach, taking into account the individual's overall health, their exposure history, and the possibility of, those multiple infections.
That sounds like a difficult task,
Yeah.
even for medical professionals.
It is. They need to be able to connect the dots, recognize patterns, and make those informed decisions based on the best available evidence.
This highlights how important it is to have access to reliable, up-to-date medical information.
Absolutely. That's where sources like the CDC and reputable medical journals play such a vital role. They're providing healthcare providers with the guidance they need to make those sound clinical decisions.
It's like a constantly evolving roadmap, then, for navigating the complexities of public health.
Exactly. And it's a reminder that, we're all in this together. Public health is a shared responsibility, and we each have a role to play in protecting ourselves and our communities. You can even find, helpful resources like a list of recommended vaccines for your age group and your risk factors directly on the CDC's website. Or, better yet, you can talk to your doctor about creating a more personalized plan.
I'm adding that to my to-do list. This has been a really eye-opening conversation. We've covered so much ground today, and I feel much more confident about the current landscape of respiratory illnesses and how to stay healthy this winter.
I'm glad to hear that. And keep in mind, this is just the start of the conversation. As we learn more about these viruses and bacteria, our understanding is going to continue to evolve, and so will our strategies for prevention and treatment.
As we head into the heart of winter, we can't forget about those everyday environmental factors that can also impact our respiratory health.
You're right. We often overlook things like dry air, indoor allergens, even air pollution. All of these can irritate our airways and make us more susceptible to those infections.
It's like our respiratory systems are under attack from all sides. What are some things we can do to, mitigate the impact of these environmental factors?
Well, during the winter months, when our heating systems are working overtime, it's really important to make sure we're keeping the air moist. Using a humidifier can really help prevent that dryness and irritation, in your nasal passages and your throat.
I always notice a difference when I use a humidifier, especially if I'm feeling congested.
Yeah, it can really help. It loosens up the mucus, makes it easier to breathe. And speaking of mucus, it's also important to stay well hydrated. Drink plenty of fluids throughout the day.
We hear it all the time, but it's easy to forget, especially when it's cold outside and we aren't feeling as thirsty.
True, but staying hydrated is so important for maintaining the health of our mucous membranes, which act as that first line of defense against infections.
Now, what about allergens? I know some people really struggle with indoor allergens like dust mites and pet dander, even during the winter. Can those contribute to respiratory problems?
Absolutely. They can definitely make those respiratory symptoms worse. So regular cleaning, vacuuming with a HEPA filter, using allergen-proof covers on your mattress and pillows, all those things can really help reduce your exposure.
I imagine air purifiers could be helpful too.
They can. They can filter out a lot of those irritants, dust, pollen, pet dander, even some of those airborne viruses and bacteria. So that can really help improve your indoor air quality and reduce that risk of respiratory irritation.
It sounds like we're talking about creating a healthy indoor environment, almost like building a protective bubble against those environmental triggers.
I like that analogy. It's especially important for those who are, more vulnerable to those respiratory illnesses of young children, older adults, and people with underlying health conditions.
So it's about being proactive and taking steps to control what we can control, you know, in our own homes.
Exactly. And when it comes to things we can't control, like outdoor air pollution, we can still make informed choices to minimize our exposure.
Like checking air quality reports and avoiding strenuous outdoor activities on days when the pollution levels are high.
You got it. It's all about being aware of your surroundings and making those adjustments to protect your respiratory health.
So it really is a combination of those individual actions and environmental awareness that can make a big difference.
It all works together to create that more comprehensive approach to respiratory health.
It's like we're building a multi-layered shield then against those winter respiratory threats.
That's a great way to think about it, and it's so empowering to know we have the tools and the knowledge to protect ourselves and our loved ones.
I have to say, this deep dive has been incredible. It's really given me a whole new perspective on respiratory illnesses and how to stay healthy during this time of year.
I'm so glad to hear that. But remember, this is just a glimpse into a constantly evolving field. There's new research coming out all the time, and our understanding of these illnesses will continue to grow.
So the takeaway here is stay curious, stay informed, and stay proactive.
Absolutely. And never hesitate to reach out to your healthcare provider if you have any questions or concerns. They're your best resource for, personalized advice.
Mhm. Well, I think we've covered a lot of ground today, given our listeners plenty to think about. Any final thoughts you want to leave us with?
As we navigate the complexities of winter respiratory illnesses, let's remember that we're not alone in this. We have a wealth of resources available from healthcare professionals to public health organizations to that, ever-expanding body of scientific knowledge.
We're all in this together.
Exactly. And together we can make those informed choices, take preventative measures, and stay healthy throughout the rest of the winter season.
That's a great note to end on. Thanks again for joining us on this deep dive. It's been a pleasure learning from you.
The pleasure was all mine. Always rewarding to have these conversations.
To all our listeners, we hope you found this exploration informative and empowering. Stay well, stay curious, and we'll catch you on our next deep dive.